Hello, everyone. Thank you for joining us today. Welcome to the efficacy webinar series. Our topic for today is gut health and treatment for mycotoxins, myth versus medical evidence. My name is Christopher Chu. I'm the Director of Marketing for Vexia Diagnostics and will be your host for this webinar. Today, I have the distinct pleasure of being joined by an exciting guest, Dr. Andrew W. Campbell, who will be our presenter for this webinar. Dr. Campbell, medical clinician, director, officer, advisor, and medical consultant, also editor-in-chief of several medical journals and research studies, was selected as a top medical consultant of the year for 2020 by the International Association of Top Professionals for outstanding leadership, dedication, and commitment to the healthcare profession. In past years, Dr. Campbell has been recognized as one of the top 100 health professionals in clinical immunology and toxicology, as an International Health Professional of the Year for his outstanding contribution to clinical toxicology, and was named countless times by marquee who's who as an expert in medicine and healthcare, and science and engineering across America and throughout the world. Aside from his successful career, Dr. Campbell is a sought-after lecturer and speaker, nationally and internationally, at medical conferences for over 25 years, and at Oxford University in England and Harvard School of Medicine. He has published over 100 studies of his findings in peer-reviewed medical journals and medical textbook chapters. Without further delay, I will now turn the webinar over to Dr. Campbell.
Hello, folks. This is Dr. Andrew Campbell, and this is gut health and treatment for mycotoxins. Myths versus medical evidence. As you can see, I'm the author of over 100 studies. I'm on the editorial board of 5 medical journals, and I'm a member of the Royal College of Medicine in London. This is what Scientific American said, that the next deadly plague, the growing worldwide threat of fungal disease. That's why it's so important for us to know. You read about floods every day, weather changes every day, etc. And this is what's going to eventually develop into the next deadly plague, because molds will grow and molds produce spores, and the spores they release into the air carries mycotoxins, and these are very toxic to humans. They're very small, they're a molecule. Most toxins are just molecules. They're not living organisms. What about the gut? The intestinal epithelial barrier represents a first defensive barrier to mycotoxins. This depends on the dynamic interaction of basically 3 areas. One is the microbiota inside the gut, the epithelial cell lining, and the immune cells in the lamina propria of the gut. The epithelial cells are connected to each other by desmosomes, adherens junctions, and tight junctions. Now, there are 4 anatomical and histological layers in the gut. One is the mucosa, then comes the submucosa, then the muscularis propria, and then last, the muscularis mucosa. The intestinal epithelium, there's 3 major cell types. The first one, and this is the great majority, are made up of epithelial cells, just 1 layer of epithelial cells. The second is the protective mucin-producing goblet cells in the villi, and third are the Paneth cells, which produce antimicrobial peptides in the crypts. The epithelial cells are connected by these desmosomes, adherens junctions, tight junctions, and these form a mechanical bond of adjacent cells to produce a physical barrier. This barrier blocks entry of large particles and pathogens and is permeable to water, electrolytes, and to dietary nutrients. Next is a chemical barrier, and it's made up of mucus, antimicrobial peptides, and the cytokines secreted by epithelial cells. The third barrier is the immunological one, consisting of the lamina propria, and these contain capillary and gut-associated lymphoid tissue. that are made by immune cells, basically macrophages, dendritic cells, and lymphoid cells. In addition, secreted immunoglobulin A and cytokines are produced by the immune system to complete this protective barrier. So therefore, the gut is a total of three interlaced systems. The first is the microbiota inside the gut. The second is the physical and chemical barrier made up of the epithelial cells and their secretions. And the third and last is the immune barrier. All three work synergistically. Total number of cells that make up the human body, 37 trillion. We are made from head to toe, 37 trillion cells. But how many number of cells make up the microbiome in the gut? 135 trillion. Well, not only that, but the human genome is made up of 23,000 genes, but the microbiome is made up of 8 million genes. And 1 little milliliter of colonic fluid contains more bacteria than there are humans on the planet. Mycotoxins. Let's talk about its impact on gut health and microbiota. This is from studies. As you can see, I always refer to studies. I was taught in medical school, in God we trust. Everyone else has to show data. So this is data. If people say, oh, you need this, you should do this and this, wonderful. Show me the data. Show me the medical evidence. Okay. So findings revealed in this study that the gut microbiota is capable of eliminating mycotoxins from the host naturally, provided that the host is healthy with a good microbiota. So the microbiome has the ability to transform the toxicity of mycotoxins by several mechanisms, most of which change and modify the toxicokinetic of mycotoxins and thereby lower their toxicity. Two mechanisms are involved, basically. One is the change to the structure of the mycotoxins by biotransformation, and the second is by changing the absorption of mycotoxins. The most common one is the chemical transformation by enzymes present in the microbe cells and those excreted by microbe cells into the gut. These reactions of hydrolysis of mycotoxins reduce their toxicity. Another effect of the gut microbiota on mycotoxins is the ability of components of microbiomes, mainly cell walls of microbes, mainly the cell walls, to form adducts and bind to mycotoxins, reducing their absorption. The bacterial and protozoal fractions are able to degrade trichothecene mycotoxins, which are pretty bad ones, such as saxitoxin, T2 toxin, and others. And a study showed that Prevotella copri and the butyrrhizobro fibrosolvins very effectively acetylated the T2 toxins and fecal microbiota hydrolyzed deoxynivalenol, which is also known as vomitoxin. Certain foods can contain mycotoxins. Mycotoxins most commonly occur in foods with poor storage after harvest, mainly in some very poor countries of Africa and in rural China. The National Institutes for Occupational Safety and Health, NIOSH, part of the CDC, has reported that very low levels of mycotoxins can be found in some foods. These amounts are in parts per billion, too minuscule to cause any serious adverse health effects. Let me tell you what a part per billion is. I asked this of a math guy because I'm a visual, and he says, take 1,000 football fields, cover them with golf balls, take one golf ball away. That's a part per billion. So the amounts of mycotoxins tested in foods have been shown in many studies to be below what is called the tolerable daily intake, TDI. And these are set by the FDA, the European Food and Safety Authority, the UN Food and Agricultural Organization, World Health Organization Joint Expert Committee on Food Additives. So these low levels of mycotoxins are found in many foods, cereals, beans. Remember, coffee comes from beans, fruits, grape juice, beer, etc. And this is all per the World Health Organization and the United Nations Food and Agricultural Organization. For that reason, mycotoxins can be found in urine in parts per billion in healthy people. Why? Because in urine, you're measuring what's left the body, not what is in the body, what is left in the body, what has left it and gone, and it's usually from these foods. In recent studies, in July 2021, Frey et al. Showed 1 to 4 mycotoxins were found in both pasteurized and unpasteurized milk from cows. 91% of all the milk tested had at least 1 mycotoxin, and 30% had 2 to 4. However, all these were below daily tolerable intake, total daily tolerable intake. And they're easily secreted in urine, as are most mycotoxins found in beverages and foods. So don't be fooled by the urine test. This is why testing for mycotoxins in urine is not helpful in assessing mycotoxins from any indoor space that's been contaminated by molds. Myth: mycotoxins colonize the gut, so you have to pull them out with binders. Here's the studies on binders. Okay, I found 2 in PubMed. Binders rely on the absorption of mycotoxins from the gut, preventing it from getting into the bloodstream. Included are kaolinite, clays, activated charcoal, zeolite, bentonite, etc. They are effective in neutralizing one mycotoxin, aflatoxin. And I can tell you, folks, aflatoxins don't exist indoors in contaminated indoor environments. And there's extensive studies that show which mycotoxins do occur, and usually mycotoxins aflatoxin always come out as 0. These binders are ineffective in all other mycotoxins. In addition, they also bind vital vitamins, as well as macro and micro elements. And there's the study for it. Here's another study. Some physical strategies, such as application of absorption agents, binders, presented no sufficient effect against mycotoxins. There you have it. Don't use binders, they're useless. And here's a young lady in her late 20s, and you can see before treatment with itraconazole, 3 months later, she was treated, this is SIBO, and she's been treated and treated and treated, and it comes back, comes back, etc. So finally, she did the test for mycotoxins from my Myco lab and had treatment, and in 3 months, this is her herself writing this. Let's talk about deoxynivalenol in the gut, also known as vomitoxin. Because of serious concerns for animal and human health, regulatory or guideline levels for DON in food and feed are enforced in more than 40 countries. Now, there you have it. There's the study this is from. Now, really, so how much do you have to eat of this, food that's been contaminated with mycotoxins? And this study, with these 2 paragraphs, the second one is the most important, but it starts out with saying, to illustrate a worst case acute exposure, the amount of oat flakes or wheat bread. So it says in the bottom, an adult with a body weight of 170 pounds would have to consume 28 ounces of oat flakes, corresponding to about 14 pounds of oatmeal, or 19.5 ounces of wheat, corresponding to 28 ounces of bread, or 20 slices of bread. No one's going to sit down and eat 14 pounds of oatmeal or 20 slices of bread at one time. So here's the most precise and accurate test for mycotoxins. Don't take my word for it. This was from a study published in the journal Toxins in October of 2022, where they compared urine testing for mycotoxins and serum testing for mycotoxins. They said that serum testing is the most precise and accurate test. They basically said that urine testing is totally inaccurate. So every test comes with a complimentary consultation with me, and treatment of for toxic molds and mycotoxins are found at this YouTube webinar that I gave. It's very complete. And on this My Mycolab YouTube channel, you can also find webinars on the treatment for toxic molds, Lyme disease, autism, autoimmune disorders, multiple sclerosis, breast implant illness, Alzheimer, Parkinson's, PANS, chronic fatigue syndrome, and PANDAS, etc., chronic fatigue syndrome, fibromyalgia, POTS, EMF sensitivity, and many others. And just to let you know, there's a study published from one medical center on Alzheimer's on the brain at autopsy. Every part of the brain had mold, including the cerebrospinal fluid. Another medical center did a similar study at autopsy on patients with Parkinson's who had died and found the same thing, molds in every single part of the brain, including the cerebrospinal fluid. I've treated, I can't tell you how many patients over the last 35 years, including kids with autism, PANS, PANDAS, etc., and they're now well. Two important points about mycotoxins. A mold that produces mycotoxins usually produces a series of mycotoxins, not just one. So it's not Stachybotrys produces this mycotoxin. No, it's going to produce several at one time. And so one mold, many mycotoxins. If a mold known to produce mycotoxins is present in a home or building, then the mycotoxins it produces are present as well. Size is also important. Why? Hair is 100 microns, human hair. Spores are 3 to 4 microns, meaning they go to the deepest part of the lung and the deepest part of your nasal sinuses. Mycotoxins are 0.1 microns, the size of a COVID virus. Exposure to mycotoxins is by inhalation, dermal absorption. Ingestion is minimal, as we showed earlier. You have patients that come to me and say, I also have Lyme. I'm also tested positive for Lyme, tested positive for Epstein-Barr, heavy metals, et cetera, et cetera. Well, that's called cross-reactivity. If you are positive for mycotoxin antibodies, then the above test will cross-react and the test will be positive, but you don't actually have the disease. So don't fall for prescribing medications and supplements because of a test result. Treat patients, not test results. And interesting thing about this long COVID that's coming out, possible role, this is 2 different studies, possible role of itraconazole as a new therapeutic option, and itraconazole for COVID-19, preclinical studies and proof of concept randomized clinical trial. Well, why does this come out? Because people stayed at home during the pandemic, didn't go out anywhere, and they breathed in spores, which carries the mycotoxins. So at present, the number of cases due to the novel COVID-19 coronavirus presents a serious public health problem worldwide. So effective treatment methods and more effective management strategies would develop as soon as possible to prevent and treat this, the new virus. And that's down at the bottom when that study from possible role of itraconazole as new therapeutic option. The other one was this one, chronic pulmonary aspergillosis during convalescence from severe COVID-19, treated with oral itraconazole, report of 2 cases. Pulmonary aspergillosis must be suspected in patients with severe COVID-19, even if they're asymptomatic, because not only IPA, but also CPA can occur following COVID-19. Okay? All right. But isn't I get this from healthcare professionals a lot. Isn't taking itraconazole really bad for the liver? I saw this on several sites. Well, it doesn't matter what sites say because those are only opinions, not medical evidence, not facts. Remember, data is what you want. Well, here's the data, and it says itraconazole, also known as Sporanox, is a common antifungal agent that was developed in the 1980s. It's been in clinical use for 35 years with an established safety record. If you look, this was 2017, 7 years ago, so it's now 42 years. Itraconazole is a broad spectrum of triazole. Make a long story, read what's underlined. It's well tolerated with doses up to 400 milligrams per day, being generally free of serious adverse effects. Well, folks, this is a paper too. So here's another one where voriconazole, the cousin of itraconazole, which I sometimes use, patients with acute on chronic liver failure and continuous renal replacement therapy. No problems. My doctor gave me fluconazole. Well, it's the wrong thing to take because there's two types of molds. One, single cell molds, which are all the yeasts, brewer's yeasts, baker's yeast, candida, etc. And that's what fluconazole treats. But it doesn't treat Aspergillus, Stachybotrys, Penicillium, Clostridium, Fusarium, etc., which are multi-cell molds. But itraconazole treats both single cell and multi-cell. So there you have it. And if you're prescribing supplements, a recent study showed 11% of nearly 60 tested dietary supplements actually contain an accurate amount of the key ingredients. 11%. 40% did not contain a detectable amount of ingredients at all. 40%. And this is why it's vitally important to do your homework before selecting supplements, as I have done for the last 35 years. If you want to know which ones these are, don't hesitate to shoot me an email. And then lastly, ERMI test. Please take a look at the date on the right lower corner, August 22, 2013. That's more than 11 years ago that the public may be making indoor mold cleanup decisions based on an EPA tool developed only for research applications. It doesn't help. You need a different kind. And in one of those many webinars I've given that are on my Microlabs YouTube channel, there's one with Brantley May, two webinars with Brantley May, who's an indoor engineer, a building engineer, and he discusses the pros and the cons of every type of test to be done during an inspection of a home. So there you have it, folks. I hope you enjoyed this. If you have questions, the treatment is a whole other webinar or presentation video. So this is to help you. And again, if there's anything you need, please contact Avexia. They're great people. Thank you so much. Bye-bye.
For any questions or issues you may have, please contact Avexia Diagnostics by email at info@avexiadiagnostics.com or by phone 5 days a week at extended hours, 8 a.m. to 8 p.m. Eastern Time at 888-852-2723. Thank you, Dr. Campbell, for that informative presentation. Thank you all again for joining us for this webinar event. Until next time, from everyone at Avexia Diagnostics and My Mycolabs, stay healthy, stay safe, and we wish you all the best on your pathway to wellness.